Good morning. Today we're going to talk about the complementary and alternative therapies, and you're going to see throughout this a lot of people will recognize some of the names. Just know that this is more readily used these days amongst everyone, and you look at it as homeopathic, nutrition. You'll see it in the way of essential oils. So many things are going to be going homeopathic. People want to go back to the traditions with the up and coming generations. So just be aware through all this that you know that these aren't FDA approved and that they are good things a lot of times. You just have to know and be open-minded, yet know that some of these things will counteract with medications that the doctor's prescribing. So when we're getting a home med list on all the people that come in, and we have to do a history, and physical, you may not be having to do that, but you can assist in it. And then you want to make sure you also list the different medications, or actually vitamin supplements, herbal therapies, anything that they may be taking that are alternative medicines. So, complementary and alternative medicines are used about 40% of the adults now, and they're either want to complement or actually replace traditional medications. Now, with these practices, they include, but are not limited to, botanicals, nutritional products, herbal supplements. It's really important that the nurse knows that the alternative medicine and note the use and how they are used in their assessment. Now, botanicals are additives, the substances that could come from plants. Now, an herb is any plant that is used for either culinary or medicinal uses. Therapeutic value of plants is based on the phytomedicine. Now, many Americans use botanical dietary supplements for therapeutic, preventative reasons. Herbal therapies have really surged in popularity. You can even see some physicians that are urging people to take it, and it's not wrong. You just have to make sure when you take it, how you take it. Say, for instance, even when you're looking at vitamins, vitamin D, it's basically a oil-based, or it has to be absorbed with food. It's not well absorbed without it. There's different things like vitamin E. It can build up toxicity as well as A and D. There's things that you should know, like vitamin B. It's all water soluble. Some people take B all day long and they're not going to absorb it unless it's methylated, and that means broken down with enzymes. And so it's important because so many things are processed today. That is one of the reasons people are going towards supplementing. So now healthcare providers and consumers are asking questions about herbal therapy effectiveness and potential toxicity and reactions with the conventional medications. because there are no regulations on herbal supplements, and so that's the reason they're questioning the safety and efficiency. The nurse should encourage her patients to research the product prior to the consumption. Now, herbs can be useful, but they also can be ineffective, uh, or even dangerous. So you want to know that the National Center of Complementary uh, Integrative Health, which is NCCIH, lists current clinical trials with herbal products on their website. You can go through here and see basically what I've just said. Um, the the current manufacturing practices. Um, you're required to ensure that the products are safe and that the label information is truthful but not misleading. However, they are not required to demonstrate a product's safety before the product is sold. So basically, they're not FDA approved. Now, they're intended to be a supplement of a diet that contains no one or more ingredients, including vitamins, minerals, herbs, or other botanical amino acids and certain other substances, um, or the constituents intended to take by mouth in forms such as tablet, capsule, powder, soft gel, gel cap, or liquid. Labeled as being dietary supplement, again, we'll say that. Now, you will see some, you want to look at the label. Some states they're standardized, but that means that they do go through more of a rigorous study, and they're pure. They're standardized. If you're going for supplements, you really want to look for that on the label. You're going to pay a little more, but you're not. It's basically like if you go and get herbs or spices for your food. You're learning now. So many of these companies are using really old, inexpensive herbs that have been around, and they lose their potency. That goes for also stating for the vitamins. So you want to make sure that you're getting the vitamins that are have the best standardized potency, and it's not just old ingredients. So packaging of the labels and supplements much bear the wording. The statement is not evaluated by the U.S. Food and Drug Administration, FDA. This product is not intended to diagnose, treat, cure, or prevent a disease. Here again, this is the different ways they come in, the different ways people use them. Some people even make their own. So you'll see this. There's a lot of literature over these particular things. I don't have anything against it. I think that people need to listen to their physician and remember it's all about safety. Now, the commonly used herbal remedies, you'll see that this astragalus, I looked that up, and basically it states it's for your digestive issues. It can be used for inflammation. Now, it also helps with limiting cold and flu. Helps, but I looked at it. It said it was helps with diarrhea. Now chamomile, it relieves anxiety. A lot of people drink chamomile tea. It's digestive, complements skin conditions and oral ulcers. It may have sedative effects. And now you have allergic reactions to urticaria, um, and has a bronchoconstriction if allergic to daisy or ragweed. So you have to really know if you're going to start doing this. You really need to go to the physician and see if you have any allergies to any type of herbs or plants before. Um, if you're not going to do that, at least do a little skin tag test with it. So, because many people find they're allergic to it. Cinnamon, and that's a widely thing used lately. It's put in just about anything. It's supposed to help regulate blood sugar, treat bronchitis, GI problems, anorexia, like I said, diabetes, general safe allergic reactions, may decrease blood clotting. And then you have the echinacea. It's used for colds, flu, infections. It stimulates the immune system. And you'll see that some things that are used in the old days, in the first apothecaries, and then the drug companies did utilize like valerian root and things like that when making compounds for medication. So it's not all bad. It's just sometimes overhyped up. Garlic, it's great use for many things. It's just the getting used to the smell because it does off gas, and so you want to look at the things that it does for you. Ginger is great for nausea, inflammation. So there's all different types of things. Ginkgo biloba helps with fatigue, helps with brain fog, helps with all these. It's supposed to do all these different things. So I can't say it's totally would do all that, but it's supposed to help with um, you know, alertness. Now you have the ginseng. You have hawthorn berry. Well, that's usually what that is. It's usually hawthorn berry. And then we have uh, licorice milk thistle, peppermint, St. John's wort. St. John's wort will really interact with a lot of medications. Remember that. Turmeric. Turmeric is one of those things that you need to. It's really great anti-inflammatory. That it's really being talked about recent. The best thing to do with turmeric, because when I was told you a lot of the things that are old and they're not pure, they've been around a lot, they lose their potency, is to actually get the root and make it fresh. And it does help with it's anti-inflammatory. And then you, like we said, the valerian root is used for pain, trouble sleeping, different things like that. Consumers and their healthcare providers must be alerted to the potential hazards with herbal therapy. Although herbs are natural substances, natural doesn't always mean safe. A lot of different flowers, different um, plants, and I really wish there was a plant that the people used to use. Um, in, say, the Renaissance period and even later, if they felt that they were going to be executed, or if they're going to have to be in harm's way, they would literally make a tea of this specific poisonous flower, and they would die before they would have to subject themselves to a death of hanging or anything like that. So it's very interesting, but it's just something that we need to remember. It's all about safety. So people are being misled on a lot of these products. Not all, like I said, not all of them are safe. Many products have significant for patients facing surgery because of the fact it could thin the blood. It could, hurt or have a side effect with the anesthesia, especially this St. John's wort here. As we've already talked about turmeric and valerian, the potential hazards. You can see that they are drug interactions. They could affect the lab results, and you could have a false negative, false positive. And also another thing that you would have to see, that some of them could give you a positive drug screen. And so that's why you have to make sure you list everything that you take. Always discontinue herbal 2 to 3 weeks before surgery. So you can look up a lot of these resources and check it out and let you know. Let's see, don't make sure you check with your provider. Do not take if you're pregnant. It says do not take when you're nursing. Milk thistle, I will say that you can take when you're nursing. It actually helps with the milk production, but you always check with your physician first. Do not take a large quantity of herbal preparation. Follow the label instructions. Discontinue if any side effects. All about safety. So you want to make sure that you just have a lot of knowledge about these certain things. Now, with a patient uses herbal products, and identify at least 4 guidelines that the nurse should teach the patient for the responsible use of herbs. So we went over that, so keep that in mind. Use all your terminology. Read those. We'll have a guided reading. You could basically go along with with the recording and fill that in, and then you can just NCLEX questions related to herbs and supplements, and you can also look into the Elsevier. So I think we just about covered all this, and the key points that and the objectives are important. So if you have any questions, let me know. Okay, thank you.